So
I guess we should
we should
start.
start.
Yeah.
Yeah, the floor
Yeah.
is yours.
Okay,
Okay.
thank you.
Yeah. Well, hello and good afternoon or good morning. It's so great to be here. Myself, Dr. Rosina Mete, and as well as Dr. Alyssa Weiss, we're here to talk about EMDR and IFS, culturally aware implementation when empowering communities post-crisis. So we'll just start with our introductions. Um,
Okay. Hi, I'm Dr. Alyssa Weiss. Thank you again for having us here. We're excited to present. I am a licensed marriage and family therapist in Florida and approved AMFT supervisor as well. So I supervise candidates for licensure. I'm also certified in trauma, and I am an IFS certified level 1 training. I'm going to start level 2 training. I'm just not sure when. And I am a course lead and full-time professor at Yorkville University, and I serve on various editorial boards. And I work primarily with families and couples with either trauma or with special needs and chronic illness, pain. So thank you again for having us here.
Thanks. And hi. So as I mentioned, my name is Dr. Rosina Mete, and I'm actually from Canada. So I'm a registered psychotherapist, which is the equivalent of a clinical mental health counselor in New York State. I'm also a Canadian certified counselor. I'm trained in EMDR, and I'm ideally starting IFS training in this upcoming fall, which is very exciting. Currently, I'm the interim chair for the doctoral program in counseling and psychotherapy at Yorkville University. I'm also a board member for the Canadian Association for Suicide Prevention. And then as you can see, my educational credentials are there as well. And Dr. Weiss and I have collaborated on some other topics as well, including a chapter examining online counselor education. And we currently have some publications in the works as well in regards to AI. But we're happy to be here to discuss EMDR and IFS, two modalities that are near and dear to our hearts. So just to start with the learning objectives, basically, as you can see on the right of the screen, it talks about understanding the psychoeducational basics of EMDR and IFS, and how to incorporate and address trauma, and as well being able to identify how to explain and develop both therapies to communities who have experienced a traumatic event. And participants will learn how to establish safety practices and self-soothing with a community that has experienced a traumatic event. They'll also further develop their cultural knowledge to adapt EMDR and IFS with sensitivity and respect, and learn about cultural considerations for both modalities as well. So first, we'll start with EMDR therapy. So for those who may be unfamiliar or you might be new to this therapy, it's eye movement desensitization and reprocessing therapy. It was developed in 1987 by Francine Shapiro, and it's designed to resolve unprocessed traumatic memories in the brain. And it's based on the AIP model of adapted information processing. So with EMDR, some of the benefits of EMDR, it can help individuals reprocess past events, leading to improved coping skills, improved communication, and it can significantly reduce symptoms of anxiety, depression, and PTSD. It can also help in improving relationships. And at present, it's actually been approved by the World Health Organization and the American Psychiatric Association for treating trauma. So exciting times. And then we do have just a brief video just to show what EMDR therapy is. So I'll just play it, but let me know if you can't hear the music and I'll re-share my screen. Oh, whoops, sorry, that's an ad. I'll stop the share for a second and then bring it back up. My apologies. Hopefully it goes by quickly. Oh. Okay, perfect. So now I'm just going to I'm just going to re-share my screen just to make sure that the sound is shared as well. Okay. So let's just start from here. So here we go. Oh, sorry about that. I'll just
At Wayfair, we get pretty excited about furniture. Around here,
wait,
it's not a
it'll
patio, it's
stop
patio.
too.
Oh, I love.
Here we go. It's a brief video. Oh, okay. So unfortunately, we won't be showing the video. I'm not sure what's going on. Apparently, something's up with YouTube and advertising. It keeps showing me ads instead of the video. If people are interested, Alyssa and I share our emails. I'm happy to send you basically the video so that you can peruse it. But essentially with EMDR therapy, and I'm going to go over the different stages with that video, what it really highlights is that people come to EMDR therapy and they feel kind of overwhelmed by those traumatic symptoms or anxiety or depression. And often we say like they're stuck, right? And they can't really separate themselves from those symptoms or feelings. So with EMDR, what it's really about is helping people to reprocess how those thoughts come up for them to ensure that instead of feeling high levels of distress, those thoughts now evoke very low levels of distress. And consequently, after completing a therapy like EMDR, they then may be able to really engage in a cognitive based therapy like CBT or ACT therapy as the distress surrounding the situation is much more manageable to them. So that's essentially what the video showed. And apologies, I'm not sure why the advertising is so hyped today. So this slide goes over an EMDR overview, the 8 stages. So as I kind of provided a very brief summary of what EMDR is all about, but when meeting a client for EMDR, the first and vital step is history taking. So finding out, if you're talking to someone with trauma, when the trauma began, similarly for anxiety and depression, how they're impacted by these symptoms, how are they currently coping, etc. Completing helping the client prepare for EMDR therapy. So essentially going over some of the different concepts, completing an assessment and desensitization, along with installation, body scan, closure, and reevaluation. So this slide kind of summarizes it nicely, but the next slides provide even more in-depth information about all of these stages. So as you can see, I really highlighted the history and treatment planning, but for preparation, this is where, again, you're still building that therapeutic rapport and alliance. You're explaining all about EMDR, and you're also setting clients' expectations. So I've had clients who come in who've had years of trauma and they're expecting everything will be fine in one session. So sometimes it's good to have those conversations just so they can manage realistic expectations. And then, of course, making sure that clients have techniques to cope with any like emotional disturbance which may arise. And then with the assessment, this is where you're identifying the event when you're reprocessing. So that can include like the images, the beliefs, feelings, and sensations. I've often worked with people who have eating disorders and trauma. So sometimes it can be like a specific event, and then the feelings or thought, the feeling that comes up is dread or frustration or sadness. And sometimes the thought can be, I'm not deserving. I'm not deserving of food, or I'm not deserving of a good life, things like that. And then, of course, you're also doing an assessment of the subjective units of distress and validity of cognition. Then with desensitization, so you may have seen with EMDR, often people talk about eye movements. So even if you connect with a client virtually, they can do eye movements, or they can do something called a butterfly tap, where you essentially cross your arms almost as if to give yourself a hug, and then you lightly do rhythmic taps. So that's another way. Other people also may use sound, so just having intermittent tones. So again, that this occurs while the client is thinking about the traumatic event, holding it close to them in their mind. And you're going over this reprocessing or desensitization to decrease the client's subjective units of distress until it reduces to 0 or 1. if appropriate. And then you're also then allowing for new thoughts, images, and feelings to come up. So you'll see as the client is reprocessing, they may start to mention, oh, I feel more comfortable with myself, or I'm not as angry with myself. And that goes hand in hand with installation. So this is where you're strengthening a positive belief that the client wants to associate with the target event until it feels completely true. So in the example I gave earlier, that could be, I am deserving, I am deserving of happiness. And then after this occurs, you have the client do a body scan from head to toe where they hold in mind the target event and the positive belief. So they kind of just scan their body to notice if there is there any lingering disturbance, like is there still maybe tightness in their chest, or do they feel like anything in their jaw, or do they feel any sense, in their body? And if they do feel something, that's where you would go back to BLS and have them process that. And then with closure, that's where you're assisting the client to return to a state of calm in the present moment, whether the reprocessing is complete or not. And essentially, the reprocessing is complete when the client feels neutral about it. So the SUD is 0 and the positive belief feels completely true. So this is where it may take a few sessions as well. And then at the beginning of each new session, the therapist and client will discuss recently processed memories to ensure that the distress is still low and positive cognition is still strong. So I recognize that I've done a lot of talking about EMDR, and this is part of the reason why the video was so handy. It showed it to you in more of a visual manner, but happy to answer any questions which you may have as well. So now we go on to internal family systems. So I will pass the slides along to Alyssa, and I'll just move the slides, Alyssa. If you pause at the end, I'll know when to change them. Yeah, thanks. Oh, I think you're just muted.
Yeah, you just muted. Thank you. So internal family systems. So yeah, I need to slide. So with internal family systems, it comes really from a systems approach. Dr. Richard Schwartz developed it, who was a marriage and family therapist, and it combines system thinking and family systems. And what it is the concept is based on an individual cannot be fully understood in isolation. So we have all of these different parts. We're involved in a system, and the system affects us. Just like I always say, when you're in therapy with an individual, you're also in with everybody else in that therapy room, just because they're not sitting there, because everything is affecting you that you are involved in. Wait, back one. So the concept of this is it's a general systems theory. It's evidence-based. The basic assumption is we all have these sub-personalities or parts. And so when I'm trying to do this with a client and I start to say, explain it to them, and I say we have sub-personalities or parts, and they're like, wait a second, I hear voices, or I have all of these things going on in my head. So you really want to go piece by piece when you're talking about IFS, because people get thrown off with parts and sub-personalities. So you want them to learn to recognize that, with anxiety, that affects us. That's a part of us. So how does the anxiety affect us? So that's how I start with them when they talk about anxiety, labeling that part. So, one of the roles of each part is to comprehend with the therapist and the individual work towards the healing. So how are you going to heal this anxiety? What are we going to learn about the anxiety? Where did the anxiety come from? So it's managing these new situations and the conflict. So you're going to achieve better coping mechanisms and a sense of self. So this is just the assumption. So there's these 6 F's that surround the self. So the self is in the center. So that's you. And then around it, we focus on, which we're going to start off with that. That's the focus on the part, however it makes self known. So how does that part make the self? How does it feel the self? Then we find out the inner system feels towards the part. What do you want to know about it? What are your feelings towards that part? Then find out what the part wants the self to know about. So we teach them to ask questions about that part. So they're getting to know the part. Then you befriend the part. Notice the range of closeness. Are you ready to befriend the part? Are you ready to engage with the part? The other one is find out about the fears of part. The whole thing with self and the parts is that, They are going to ask the questions. And when you're working with the client, it's every step you're checking in with the client. Are you okay to talk to the part? Are you okay to ask these questions? What is the part feeling? What are you feeling? What is the part saying to you? Okay. So again, now we all have these parts. So there's 3 distinct parts, and you experience in them in different ways. Your thoughts, your feelings, your sensations, what's going on for you. We all have something that protects us. And really, when you're as we move further, you'll find out that with these 3 parts, the self is protected, but the one that felt the trauma is being buried. So it's a complex system of interactions within ourselves. Okay. So here's the self. So there's the 3 we experience in different ways, the thoughts and the feelings. Born with all these parts. The self is the main thing. So if you always remember, self is in the middle of the circle, or as you see in the slide, it's the piece that stands out the most. And then everything else is surrounding the self. The feelings, the anxiety, if you're using anxiety, the anxiety, the trauma, all of those things are now surrounding the self. So the 8 C's of the self are the calmness, the curiosity. So this is what you're trying to experience within. And you always remember the 3 C's. So are we calm? Are we curious about the next part? Do we want clarity? How do we show compassion? What is the confidence of the self to talk to that part? And this is what the role of the therapist is to help the self build up these C's, to connect, to be creative, to be calm with the part that we're exploring that's causing the feelings that we're having. Okay, and so now we become frustrated with ourselves. That's why we have the 5 P's, because we either are anxious about dealing with the part, so we have to learn to be patient. It's okay if we're not getting the answer. It's okay if it's not happening fast enough. We have to just be present with that part. The part might not be ready. The part might not be comfortable. The self might not be comfortable, and that's okay. There are times where you need to be persistent, but remember the C's, being calm and persistent. Then we're looking at the perspective. What is the perspective of the self with this part? What is the perspective of the part with the self? And sometimes we just have to be playful with the part. So we're learning to make the part feel comfortable, getting to know it, what we both, the self and the part, need from each other in order to heal the trauma. So here we go. We all have the parts. The protectors, which are the managers and the firefighters, and the exiles. And as we move on, I'll explain each of these parts and what their role is. So the manager, that's the one, just the definition says it all. One, daily life. They're the proactive. Think about managers at work. Some are, boom, 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 A, B, C you have to do, and some let you be flexible and go at your own pace as long as you get your job done. The case with the manager, with the self and the exile, is they're there to protect you. They will be proactive. They do not want you to feel anything. They want you to just keep going, and keep going. They want to control every aspect of what's going on. Okay. Now you have the firefighter. Think of what a firefighter does. Puts out the fires. Has to be on their toes. Got to be impulsive. Well, that's exactly what they do here. They're reactive and impulsive. So the part starts to feel the trauma again. The manager's trying to control it. The firefighter's coming, no, we don't want to feel this. Let's get this out of our way. Let's do whatever it takes. Think about it. If you're a compulsive, you like to shop, you're going to go online, you're going to buy because you don't want to feel anything. So it's going to get, retail therapy helps all the time. So that's what people do. Or someone with, a lot of it is with, alcohol or drugs. Those are the impulsive. Instead of stopping to think or feel, because it is uncomfortable, and that's why you go back to the 5 C's and the 5 P's of trying to be okay with it. The firefighter does not want that to happen. They don't want you to feel. They're going to be the hero. They're going to make it all better, but yet they don't look at the consequences of what's happening. Okay. Now this is the exile. They are the parts that carry the trauma. So they're the ones that are buried. This is what the manager and the firefighters are protecting. in order for the self to function. So you have buried this person, this exile down. And what I always think of it is, you got the jail bars behind it. We're not letting them out. We don't want them to be out because we don't want to feel it. If we feel it, how are we going to handle it? And those are where the parts are being held. And that's why the self needs to come and work through these parts so the exile can be released. So as I said, when you're working with the client, you're going to explore the traumatic event relationship which affects the client, the impact. What is it done? What is it doing for you? How does it affect developing the relationships? When you're using the IFS, you're going to explore the client's exile managers and firefighters. What do they do when the managers are coming out? How do their managers handle them? What is it? What if the manager is not strong enough and the firefighter comes out? What are your firefighters? Is it the shopping? Is it the drinking? Is it the over-exercising? And some techniques that you start to teach with IFS is the mindfulness, self-compassion. It's okay. It's hard to feel that pain again, but you need to be compassionate with yourself. You need to, be persistent, be patient, self-accept. That's why systems theory comes in. With the mind of the trauma theories. It's the mindfulness of what are you feeling? How can I work through it? I don't have to always react. I can feel the pain and I can sit here with it, but what do I need to do if I'm going to sit here with it? So the benefits are gain a better understanding of how to heal the trauma, learning to be compassionate about yourself, learn to balance life. Things happen when you just don't even know that it's going to. So how can you react differently? And then it helps you amend all these behaviors that you're not happy with because of the trauma and allowing the trauma to affect other relationships, your daily life. So integrating IFS with EMDR. It is possible. The theories complement one another, as Rosina and I learned as we were, talking about this, how we even got to this topic. So the research has shown efficacy within case studies. I don't know if we'll have time. We had a case study. I don't know if we'll have time, so we can always send that to you too. And the protective parts may show up in different phases. So IFS helped transform the optimal functioning, which correlates with the EMDR. So like when, she was saying about the butterfly tapping, a lot of that can be, when the individual is feeling a certain way, that's the mindfulness. Where are you feeling in your body? Start, doing this to calm yourself down, to be okay, accept what's going on. And then we go back to the part. Then we go and ask the questions. I don't know if Rosina, you want to add more with this?
Yeah, no, I was just going to agree with what you said. And in some countries, so in the UK right now, there's actually an argument with researchers and clinicians that IFS will strengthen EMDR. So there's more and more research coming out on this as well. And as you can see at the bottom, it mentions, clinicians can first start to integrate IFS to check in with those protector parts, by asking the client, do any parts of you have fears or concerns about doing EMDR on this target? So yeah, they definitely complement one another really nicely.
Right. And another thing with it is that another thing is that with EMDR and IFS, there is that constant check-in with the client and just being with the client, sitting there, not moving forward until they are ready.
For sure. So now we're going to start to discuss a trauma-informed community approach. So essentially, if you were integrating EMDR and IFS with a community who had experienced traumatic event, here are just some, easy kind of tangibles that you could follow. So dividing the groups into dividing people into groups of 8 to 10 with one facilitator. The second piece is really important, acknowledging that there is pain. Often when I hear of people who have gone through like a traumatic incident with others, there's still this kind of stigma around it, like don't talk about it or push past it. And then of course, explaining the benefits and challenges with EMDR and IFS in treating this right now, discussing the importance of somatic healing, right? We know the body keeps the score. And we know how important it is to really address those feelings so we aren't walking around like this all day. using plain language. So making sure you have, examples, metaphors, etc. And then preparation. So how can you, really ensure safety? So for EMDR in the community, there are two researchers who have developed an integrative EMDR group protocol treatment for those who experience the same type of ongoing or prolonged traumatic event. So this could be dealing with natural disasters and violent conflicts, emergency response personnel, military on duty, or life-changing experiences with ongoing traumatic event or extreme stressors. So this could also be refugees, people experiencing long-term disasters, prolonged violent conflicts, or terrorism. And so they recommend individualized experiences within a group using clear examples that people will understand, such as being safe while reprocessing. So often you may hear with EMDR when we're reprocessing, we're passing the memory by almost like we're sitting on a train, and the memory is essentially what's beyond the train. So it's just there in the background. We're just passing by it. Of course, using assessments to determine the pre and post effectiveness, using group self-soothing exercises, and of course, demonstrating the activity before each individual completes it as well is really important. Yeah. And then we'll talk a bit about IFS in the community.
So IFS in the community would be, again, with the trauma therapy, you're performing with compassion. So you're reparenting the inner child. So if it's like, I'm remembering the case study. So it's where, something happens to somebody that's important, there's an accident or something, and this person's very important in the community, which affects everyone in there. So as, Rosina said, having a group setting, you would have them come in and you would be talking to them. Like, what is that, having sit with them, so, you lost somebody important. How do we work through this? What else are you feeling towards this? Because it could be the fact that it's triggering another response for everyone differently. So it's sitting and asking these questions about, what's experiencing, how are you dealing with this and controlling for your daily basis. This is what's going on in the community. How is it? Yes, the community is going to be different now, but how will that affect you? How is individually? How are you moving through it? What is the experience going on? And exploring their parts. Well, I'm anxious now because this person was somebody I saw every other day. I'm not going to see them now. I don't know who I'm going to talk to. It's creating this. So you sit with that person, and you'll find out when you do this with a group, a lot of them are having the same feeling with that. So then you could basically have all of them talk to this one part. So if there's anxiety, seems to be that asking questions to that part, and more than one person asking the questions. Are you guys experiencing the same feeling with this anxiety? So that's one way that you would do it. And again, I can't reinforce more as checking in with the client, because you don't want to rush this with a client, because the fear of that they get they're going to become uncomfortable. So it's always slow. I notice when I'm working with it how everything changes. Their voices change, my voice change, the mirroring of each other when you're exploring that with the client.
I'm sorry, I'm having some technical issues today, but I was going to say, Alyssa, there's a great question that was just posted. Thank you, Donnie. They had asked, what about working with a family versus a group of individuals? So I just wanted to kind of reiterate what Alyssa had mentioned, like checking in with the client. But I think if you're working with a family and integrating this approach, it is possible. But I would also just consider that like if it's, let's say it's a family experiencing grief of a sudden, a sudden and unexpected death of someone, I would definitely encourage you to have that conversation with the family, in the sense that everyone's going to have different experiences with that individual. And so making sure there's even kind of a sort of a gentle counseling agreement, like we're here to listen, to respect one another, etc., and really ensuring that they have some of those techniques Alyssa mentioned as well. I've also called them self-soothing, because most likely the first couple sessions will bring up a lot of, historical information. When you're doing that history taking, people will have different experiences. And of course, checking in about readiness. So if you have someone who's very resistant to some of these ideas, and then you also have the family dynamic, historical context, plus the grief, that's a little bit different than just a group setting, right? Of individuals who may not be related to one another. So I would also just be cautious. But as Alyssa said, really making sure you're communicating with your clients, making sure you're prepared, and ensuring that the clients are ready, I think goes a long way. And then Alyssa, I don't know if there's anything more you would add.
I would, what I think you said it too, is a lot of the first session of using these approaches is explaining it. And I think when I'm doing IFS, if I find that the client is wanting to do IFS, that like I'll bring up a little introduction talking to see how they respond to it. Then if they're, they respond well to some things that I'm saying, I will further explain the role of IFS and the purpose of IFS. I give a lot more of like a psychoeducational approach with IFS versus if I was doing narrative therapy, where it's just where I ask the questions and guide them in that way. I think with IFS, there really needs to be a lot of explaining of it, because it can, all of a sudden, I'm talking about parts and we have parts and you're going to talk to this part. And many people, when I first heard about IFS and I was reading, I'm like, parts, I'm talking about part. You think of, how am I asking these parts questions? Are these people going to think that I'm not knowing what's going on if I'm telling them to ask questions of this part out there? And it's really, for some people, it's not tangible. So when something's not tangible, they're like, well, how can I ask this question? What this part's feeling. So they need that understanding. And I think with what Rosina said with the family, right, there's other dynamics of going on with a family setting versus a community. There's not these other issues in a community because they aren't related. So, there's this grief that's going on that they're all experiencing. But what was going on before the grief in the family setting? Was everyone getting along? Was there problems in the family that, is this appropriate right now to use this type of model in that situation? Because there might have been other issues that really need to be explored with the grief.
And how does that family address grief in general? Have they ever spoken about, a family member before that they've lost maybe unexpectedly, or do they have discussions about their emotions, their feelings, their experiences? I can also give a really brief example. I once had a couple who came to me and said, they really wanted EMDR because they felt like they were still grieving the loss of a pet from many years ago, but upon doing some history taking and starting to explain EMDR, what actually arose is that both of them felt like they weren't being heard in their relationship. So it wasn't so much that the grief had been traumatic, like the situation was traumatic. They had also done some grief work together, etc. But since that time, they really weren't listening to each other. So it turned into a different type of therapy. So sometimes that happens as well with families. If you have a family coming and saying, yes, we want to address this grief, but then you find out actually the goal is we want our father to make sure that he knows he has feelings. Well, making sure everybody's on the same page with the same goal is also really important. So hopefully that answers your question. I know we went on a few tangents there, but we gave some ideas too. So some of the cultural considerations with EMDR in the literature and based on the research, there is the ASK model, which takes a look at attitude, skills, and knowledge. So in terms of attitude, understanding and respecting the role of culture. With skills, again, those culturally competent skills. So allowing that time for trust to develop, sharing power, and then knowledge. So even with, cultural knowledge, just making sure you're moving away from assumptions. And EMDR continues to demonstrate cultural competence. As you can see, it's client-centered. It works effectively with translators. It allows clients to keep memories private. It accesses multiple memory components, includes simple self-assessment tools. It integrates universal brain biology into the AIP model. It also builds on existing cultural resources beliefs. It incorporates mindfulness skills valued in many cultures, and it allows for the problem to be identified or defined in the client's terms. And it is also effective for a range of adverse experiences. Yeah.
So the cultural expectations of IFS are very similar to, EMDR. All parts are welcome. So it's inclusive. Everybody's welcome to, talk. We might have to say, wait, pause for this part, pick a part, choose a part to talk to and ask that. And again, with any type of therapy, culturally sensitive therapy is important, being curious about your client, their culture, how they see therapy, how they see this form of therapy, understanding them, how the trauma might affected them due to their culture. And culture sensitive therapists hold a space for the different opinions and the value systems and the beliefs and their experiences. Again, just being there with them, being curious, holding a space for them to understand their process, what's going on, what do they need for their understanding of the trauma to let move forward. So
Yeah. So um there's
So
oh,
here's
there's
right. So again, it's the empowering narrative. So they're sharing their voice. They're telling their story with what in their own words. Understanding the impact. So if it's generational trauma, again, with culture, there's an assignment that I've always done with the genogram where people are learning about their generational trauma and how it's affected them, the impact of how developing relationships. IFS is a great way of doing this. They're learning that their relationships are a certain way due to not healing with the generational trauma. How do they need to heal with this? And building trust, building trust with the therapist building that trust with the client feeling the trust of the part. How can the part trust the self? How does the trust self, trust the part? You can't really explore and move forward if there's no trust involved. So it's understanding these emotional reactions. It's okay to have those feelings. You can be angry with the part. You can be frustrated. That's why it goes back to the 5 C's and the P's. Understanding the calmness, persistent, protecting. Okay.
So instead of a case study, Alyssa and I have a question for you. And I know we're nearing the end of our time, so we want to be mindful and respectful of your time, but we also wanted to give you an opportunity to participate. I know we've been talking for most of our presentations. So if you have your phone or if you're on your computer, we're just using something called Poll Everywhere. So if you would just like to provide kind of a brief, a few word answer, how can you build cultural competence? And then we'll take a look. So you can join by the web. So it's pollev.com/Rosina Mete 815. If you have your phone, you can text 37607 and then send Rosina Mete 815. Or if you have your phone out, you can scan the QR code. So if you're comfortable sharing, we'd love to hear from you as we enter kind of the final stages of our presentation. So maybe I'll flip over to responses, see. Oh, great. Yeah. So I'm seeing some responses by being more aware and immersing within culture, recognizing that the only culture one is an expert in is their own. Yeah, 2 very pertinent recommendations. Thank you.
Thank you.
Oh, and in case anyone's wondering, this is set up to be anonymous. So even though you're connecting via phone, we don't know who responds and you don't have to add your name or anything. So being more aware, for example, education, definitely.
And that's what, as counselor educators, that's what we're doing with future counselors, educating them about becoming more culturally aware and the culture of humility.
Mhm. Becoming curious about our client worldview. Someone wrote, I plan to build cultural competence by reading as much as I can about different cultures, as well as developing the skills to ask folks of different cultures more about themselves and their experiences. Yeah, for sure. Having that conversation is really important. and educating yourself on the topic for sure.
And,
So
with looking at some of these, being more aware and curious about our client worldview, I know with IFS, there is that time spent, asking them how they see the world that they're involved in, especially with the trauma, getting to know the trauma, which is uncomfortable in the beginning. That's why you build that trust when you're starting to explore if we're going to move into IFS, as having them talk certain things about around it, how it's affect their life and what, because most of the time when the clients are coming in, they want to heal from the trauma. So they're exploring it. So just sitting there and understanding their exploration, right? Being open-minded and curious, right?
yeah, investing in them and their history, ask a lot of questions. Yeah. Thank you all so much for your responses. Remove all biases. Yeah, ask questions. So I think removing all biases can be it can feel overwhelming. So even being aware of them and ensuring that you're, aware and you're not engaging with them, right, can be really helpful. So this is great. And we definitely see themes with awareness, curiosity, asking questions, staying informed, all of which are just great. So as Alyssa and I kind of wrap up, as we're aware of our time, we really appreciate everyone participating. So we have some recommendations as well. You'll see the themes overlap. So how can you build cultural competence? So personal awareness. So before you start to learn about other cultures, what about your belief system and your thoughts and values, right? So if I were to ask you, and I'm not asking anyone to put this in the chat, this is a reflective question for you, for yourself personally, but how do you think people should, act in relationships? What are your thoughts on finances? Things like that. Like, what about your belief systems? What about your thoughts and values? So when you realize what you think, what you believe in, and what's important to you, then you can start to take a look at, okay, how does this impact me? Is this impacting others? And how can I now learn about other people? And inclusive communication. So an example would be, do you introduce yourself with pronouns, right? That's one way to show inclusivity. Checking in. So checking in with others for understanding, and then continually learning, which I also saw within many of the responses. So here we provide an example. So there are different cultures, including Indigenous cultures, where people actually do not prefer continuous eye contact, right? So just being mindful of some of this as well is really important. So as we wrap up for today, here are some of the references that Alyssa and I used in our presentation. And I know we both would just like to say thank you for your attention today, your engagement in our questions, as well as questions in the chat. We really appreciate it. You're always welcome to send us an email. And then, of course, we both are on LinkedIn. So you're welcome to connect with us there as a professional if you so choose. So yeah, thank you.
Thank you, everyone, for allowing us to be here and listening to the presentation. And right, as Rosina said, if you have any questions, you can reach out to us or the video. If you want to see the video, we can send you the link.
Yeah, someone is just asking about that. So I'm just responding with my email. So I think it's Susie. So if you can send me an email, I will send you the video for sure. So you can take a look. And it sounds as though I see a lot of thanks. So thank you for those kind words. And then it sounds as though people are also very interested who are participating today. So that's great. Or they have used EMDR or IFS and it has been successful with their clients, which is always something Alyssa and I enjoy hearing about as well. So, yeah. So I guess that kind of wraps up our presentation for today, unless anyone has any other questions. No? Okay.
Well, thank you again then.
Yeah, thank you so much and enjoy the rest of the conference. Like I said, we really appreciate this opportunity.
Thank you, everyone. Take care.
Thanks.
Thank
Bye.
you.